Toronto Public Health and police are teaming up in a pilot project to support vulnerable people in the Yonge-Dundas area, focusing on addressing mental health and those with substance abuse issues as well. And joining me live this morning in order to break down this entire program itself is the Chief Officer, Medical Officer of Health, Dr. Eileen Davila, and Staff Superintendent for Toronto Police, Kelly Skinner. Thank you so much for joining us to talk about this program. Something that we have been watching here, we're located at Yonge-Dundas, and we've seen a change in landscape here as well. We can tell you working here in this area. I'll start with you, Dr. Davila. What prompted this project?
Well, I think it's exactly as you're speaking to, that there has been a significant change, and we are seeing some real challenges in our community. Complex chronic disease conditions, further compounded by things like increasing homelessness and underhousing. Things like mental health challenges that have been particularly prominent in the last few years, and of course substance use challenges. So when you take that mix together, it means we have some very vulnerable people in our community really not being able to experience great health, but as well it creates some community safety and well-being challenges for those of us who are in the neighborhood and in the vicinity actually witnessing this very complex challenge taking place in our streets.
Right. And Superintendent Skinner, can you tell us how police will be involved? We know that obviously we'll have the medical professionals as well, some nurses who will be out as part of this team. How will police play a role?
So really the police role is in the downtown core team is to support the social and health service activities of the nursing team to promote public safety for everybody. Police have been in this area doing this work for a number of years, and this really is taking that public health approach to policing, leveraging the existing partnerships that we have in our organization and in the community right now, and really helping to put the focus on a public health lens to the type of work that needs to be done in the area.
Right, and we're seeing a lot of people, obviously the increase in vulnerable people on the streets everywhere throughout the city is very much at a peak, but when you see it here at Yonge-Dundas, there have been other pilot projects, let's say 211 as well. This group in particular, though, Dr. Davila, will not be reachable by 211 or 911. How will this team work? How will this pilot project get out on the streets?
So this is an opportunity, an initiative that's taking advantage of the existing partnerships and building them up. And the way we like to look at it is thinking about taking primary care. So this is not crisis response. This is more akin to taking primary care out into the community to those who need it the most, those who are most vulnerable, who are experiencing that very complex sort of set of health challenges I spoke to earlier, and recognizing how do we mix that primary care approach along with a community safety and well-being approach, hence the partnership with our colleagues at Toronto Police Service, to better serve, yes, the vulnerable people who have these challenges and are experiencing them firsthand, but as well to think about how we make, community safety also the top of the agenda at the same time.
Right. And speaking about the community, Superintendent Skinner, what kind of reaction have you gotten from business owners, from residents in the area who have been here, just as long as police have seen this area kind of evolve to where it is now? What reaction are you getting from them?
So we're getting a lot of support from, we've done consultation throughout the pilot process in building and designing it, and we'll continue that through the pilot. Downtown Yonge BIA, we've liaised with SafeTO in the City of Toronto, the Toronto Community Crisis Services, as well as Gerstein Crisis Centre. We were at a town hall for Ward 13 for Councillor Chris Moyes. We're at a town hall where residents were saying, we've heard a lot of this and we're not feeling safe and we want something to be done. So I think there are people who are really hopeful and are really kind of excited to see what we can do out here. This is something different. We've never partnered together in this way before, so really excited to have us work together and try to really improve the levels of personal and community safety in the area.
Right, and to add to that, we know that the people who are experiencing the health challenges directly also describe the need for better access to service. So, looking at the community safety angle, looking at the individual health and well-being angle, this is the combination of these two things together, and I think has some real promise and some real opportunity to make a difference.
Okay. Okay, so this one-year pilot project already in effect. We'll see exactly what kind of data you're able to get out of it as well and see if it expands throughout this city. Dr. Davila, Superintendent Skinner, thank you so much for joining us. We appreciate it.
Thank you.